Before you start injecting, we have to get the diagnosis right. I teach that there are actually 3 diagnoses that need to be made. The first is the patient's story. What is it they're actually hoping to get out of this treatment? Once you know what they want, it's easier to guide them to get the right answer. The second thing is the anatomy. What are the structures of the face that change as you age, and therefore which ones do we need to treat to get the result the patient wants? And finally, there's the aesthetics. You can't interpret the anatomy and change the anatomy without understanding what good aesthetics are. So often this is where the patient starts. They want to look better and they need an expert to help them guide them to get that result. What are the components of a chin, a jawline, a cheek? How does it fit into the face naturally, so that as you inject, you create more beauty rather than less? This is what makes for an artistic injector. It's the ability to not just understand the injection points or understand what your patient is asking for, but to actually understand the aesthetic potential of the face. It's the gap between where a patient is and where they could be. We need a framework that teaches us not just about the proportion or the techniques used, but about the actual shape and detail of different elements of the face and how it all works as a whole. Mastering this missing piece is a crucial step on the success path I've developed for aesthetic practitioners. It'll transform you from a basic injector into a confident aesthetic artist, with the ability to grow a thriving clinic filled with patients who trust you with their entire facial journey, not just individual treatments. If you would like to learn my framework, click the link in my description for more information.